Welcome back to Score Values. I'm your host, Adam Harris, and I'm joined right now by two guests, Dr. Jeffrey Mjaanes. He's a sports medicine physician at Midwest Orthopedics at Rush. He's also the director of the Chicago Sports Concussion Clinic at Rush. Tim Rylander, he's a physical therapist at Accelerated Physical Therapy in Western Springs. He's a director of the company's concussion program. Two concussion experts. Gentlemen, thanks for joining me.
Thanks for having us.
Thanks for having us on.
Absolutely. Let's start with Dr. Mjaanes. Tim, we'll get to the recovery in a couple minutes here on concussions. But, Doctor, concussions, obviously a major topic in sports medicine right now and in youth sport as well. Football season is starting up. Talk about the severity, and I kind of want you to scare people about concussions, basically, because I want people to understand, parents and coaches and players themselves understand how serious they are.
Well, I think a lot of people have this misconception that a concussion is getting your bell rung and maybe just a small little ding on the brain, but a concussion truly is a brain injury, and I think it's important for people to remember that you just injured your brain, which is the most amazing organ in the body that controls everything that you do, all the feelings that you have, all the thoughts that you possess. And so an injury to that structure can be a very devastating thing. In terms of what happens with a concussion, we used to think that there probably wasn't any true damage to the brain, but actually newer studies are kind of indicating that when you suffer a concussion, you may actually be suffering some micro damage to the nerve cells in certain parts of the brain. The good news is people do recover from a concussion, but you do need to let your brain have that chance to recover and rest and get back to its baseline function. And not doing so, or actually suffering another hit in that recovery process, could actually be devastating and may actually be life-threatening or cause permanent neurologic injury.
And there's a such thing as second impact syndrome. I've heard of it. I'm sure a lot of people out there have as well. Dr. Mjaanes, what is that, and how can that occur, and how damaging can that be?
Right. Well, second impact syndrome is basically a condition where you are recovering from a concussion, but you're still having symptoms. You're not fully recovered. Your brain is not back to baseline, and the athlete suffers another hit to the head. That second hit can actually be devastating. It can cause swelling in the brain, and the brain doesn't have any room to swell, which is why swelling actually creates a huge problem. In fact, the only place the brain can go is down the hole where the spinal cord comes in the neck. So this actually shears off nerves and can lead to you stopping breathing and actually can actually cause death. So this is a very serious condition, and luckily, fortunately, it's very rare. But it can happen. It seems to only happen to young athletes, and this is actually the reason we are so scared about having athletes play when they still have symptoms from a concussion. We want to make sure that any young athlete who has a concussion has recovered fully before they get back out there on the field, court, or battle area.
You're listening to Score Values. I'm your host, Adam Harris, and I'm joined by Dr. Jeffrey Mjaanes. He's a sports medicine physician at Midwest Orthopedics at Rush. You just heard him. He's also the director of the Chicago Sports Concussion Clinic at Rush. Tim Rylander, he's a physical therapist at Accelerated Physical Therapy in Western Springs. He's also the director of the company's concussion program there. Tim, that's where you come in, the recovery and the youth especially that suffers this concussion. How does the youth treat a concussion when they come in for recovery? I'm assuming, this is my assumption, that they don't really think that anything's too wrong, especially a couple days afterwards, and they kind of want to just get clearance and go back out there and play.
Well, that's exactly right. Following injury, one thing we have to really work towards is educating the public out there, parents, players alike, in terms of the severity of this injury and how you have to be responsible in treating it. So we really promote rest initially, both cognitive and physical rest. So we usually limit how much they participate in practice as far as being there, and we certainly limit how much physical participation they do in anything. We really want to just kind of let that brain heal. And then a lot of times when people come into the clinic, the main thing they're focused on is how early or how soon they come back to perform. And in sports medicine, that's something we're always concerned with. We want to get people back to competition, back to playing as fast as we can. But the more important aspect is we want to get them back to participation in a very responsible, safe manner. So one of the first things we look at is kind of giving them rest, letting those symptoms kind of calm down and kind of get back to that normal baseline function, which in most people can take anywhere between, a week to 2 to 3 weeks. And then at that point, just to make sure that everything's kind of at baseline, ready to go back into participation, most people agree upon a staged, progressive protocol of increased cognitive and physical loading. So it's usually like a 5-step process where we start off at a moderate to low level of cardiovascular and physical exertion, and we slowly increase the physical exertion along with kind of that multitasking, dual tasking kind of cognitive component to essentially bench test the system or the neurologic system just to make sure that everything's as up to par, up to speed as possible. This is usually combined with such psychological testing such as impact or some of the other kind of computerized tests or quote-unquote concussion tests you might have heard. So it's really a multifaceted, multi-tool approach to try to look at everything from as many different angles as possible to best ensure that kid's back to be able to participate in any given sport in the most safest and responsible manner possible.
Are you more susceptible to concussion after you have had one and fully recovered with a physical therapist?
Well, there's always talk on there about if once you've received one concussion, you're responsible or you're more susceptible to multiple injuries. But one of the things that we really harp on and really stress once someone comes in on after a concussion is really education and management of the risk. So that really goes back to core competencies in tackling technique, minimizing risk, and implementing as much useful tasks or useful coping strategies as possible to negate any further risk down the line.
Dr. Mjaanes, what sort of things should coaches, and I'm assuming there's trainers there, a lot of instances there are in high school especially, but maybe youth football, there's not a special trainer there. What sort of symptoms should a coach or a parent look for in a youth that was just, had their bell rung, as people might say? How can you determine what if it's a severe enough concussion to bring someone to the emergency room?
Yeah, you know what? That's a fantastic question because I think I get that all the time, and I think there is in some ways the pendulum has swung a little too far. We have everybody so nervous about every possible hit to the head causing a concussion, and I think it's important for people to realize that not every hit to the head causes a concussion. Your brain is a very delicate organ, but it's wrapped in a nice bony box called the skull, and that does a very good job of protecting our brain. And but I think if you get hit hard enough or with a certain degree of rotational force or linear force, there's a lot of factors that can cause it. But basically, I tell people if you get hit to the head and you have symptoms of a headache or dizziness or trouble remembering things or trouble with concentration, if you're feeling really depressed or sad or emotional, kind of these ringing in the ears, bright flashes of light, these symptoms that are kind of consistent with a concussion, and you have those symptoms for more than a couple of minutes, more than 5 minutes, more than 10 minutes, you probably have a concussion, and it's better to act on the side of safety and pull yourself off. If you get hit on the head and you see stars for 3 seconds and then it kind of goes away, and after a minute you don't have any headache or anything and you feel completely back to your baseline, then you probably didn't have a concussion. I think a concussion is where there's enough injury, enough force to cause actual injury in the brain, and it's a process that has to, once it starts, you can't just get it to stop. It doesn't stop within 5 minutes. It doesn't stop within 5 hours. It kind of needs to resolve itself over a couple of days to a couple of weeks.
And then what you do is you go see Dr. Jeffrey Mjaanes, a sports medicine physician at Midwest Orthopedics at Rush, and then go see Tim Rylander, and he will help you get back to 100% and back on the field. I'm not really sure who to direct this question to, so I'm going to throw it out there, and hopefully one of you guys, or both of you, I would love to hear both of your opinions on it. The new technology in helmets nowadays, and you see just watching football in the NFL, honestly, different helmets and different teams and different shapes with different holes and different spots and different padding. how good can a helmet be to a point where can they completely, not 100%, but how good is the technology getting to prevent concussions, but still a head-on-head collision is gonna can cause a concussion down the road? I mean, helmets aren't 100% either.
Yeah, listen, I think that football helmets, plastic helmets, were developed to stop two major injuries: bleeds in the brain and skull fractures. And they do an amazing job of that. They're great at that. Unfortunately, they cannot prevent concussions 100% of the time. Could they mitigate? Could they decrease the forces that might cause a concussion? Yes. But they cannot completely eliminate the risk of getting a concussion. A concussion is just something that's going to happen when one person collides into another person or an immovable object like the ground or a goalpost. So it's that shaking of the brain, and you need kind of linear force and a rotational force, a kind of angular force to cause it usually. And a concussion can limit the linear force, but a helmet can eliminate the linear force and significantly decrease that force, but it cannot usually mitigate the rotational acceleration as well. Now, the newer helmets that are coming out are very exciting, and I think that this newer technology that is coming around actually does have a role. And I think if we could finally perfect this art of and develop a helmet that could prevent both types of forces, then we could really create a huge dent in the number of concussions. But that technology is still, being worked on. Mm-hmm. The art of making helmets has not been perfected yet. There will be newer advances coming down the road as well. And so while, again, some of these newer advances are great, they haven't really been tested thoroughly. And my biggest concern is a lot of these helmets that even have been tested, like the STAR rating, this rating system is actually developed for college football players, adults. So we have no idea if these helmets work in children or teenagers in high school. We just don't know yet. Mm-hmm. So a lot of this stuff is great and it's promising, but we can't put all of our eggs in this one basket quite yet.
So speaking of eggs, a lot of times with helmets, I use the analogy of if you take an egg and thoroughly wrap it in bubble wrap and give it all the styrofoam padding and everything, you can bang it around and that egg shell might not crack, but the yolk's still going to be sloshing around inside that egg. So, and we're talking about a concussion. We're talking about, inertial kind of movement of the brain inside that rigid structure of the skull. It's all about acceleration, deceleration, and rotational forces, such as Dr. Mjaanes said. I believe that one of the best advancements in technology that's on the market right now is really more the shift in teaching technique, coaching technique, and programs like through USA Football with heads-up tackling programs and such like that, really changing the culture of some of these high-velocity, high-impact sports, and really teaching a pure tackling technique and hitting technique to help minimize some of these head-on-head collisions.
If you guys were in front of a group of high school football players right now or soccer players, those are the two sports that really come to my mind immediately as far as concussions. Tim, we'll start with you. What would you say and what would you want to really implement into them? Because kids can get their bell rung, like we like to say, and possibly have a concussion, but don't want to leave the game. I understand that. I've been there. I'm sure both of you as well. What would you say to them to give them advice?
It's funny you say that. I just recently I spent a whole day talking to all the athletic participants, all the athletic teams at a local high school. And my big take-home message to the athletes was, we've talked about the symptoms of concussion. We talked about some of the ramifications of the injury. The biggest thing to be aware of is a little bit of concerted action on the front end, really being aware of how you feel, how your teammates feel, and what's going on, and kind of taking a step back and a conservative approach at first ultimately can lead to a faster return to the field as opposed to trying to push through these symptoms and trying to really push through, your headache and dizziness and stuff like that. I equate it a lot of times to having a cut. If you have a cut on your arm or your hand or something like that, and every single day you rip off that scab and you rip off that scab, it's going to take a lot longer to heal than if you just let it heal, let it rest, and then get back into action.
I completely agree with Tim. I would actually say as well that, I would stress the point that this is a brain injury. We do not have to be afraid of having a concussion. You don't have to, not leave your house or not sign up for sports because of the risk of having a concussion. Mm-hmm. But It is a brain injury, and we need to respect the fact that they do occur, and that is an injury, and we need to allow it time to heal and rest. And so, again, I think it's the education is the key, too. These kids need to be honest about their symptoms. Most of these things are things that we can't see from the outside. We need the athlete to tell us if they feel a headache or dizziness or trouble remembering things after a hit to the head, and we need to rest it, allow it to heal before they go back in so that we don't have any permanent issues here.
Dr. Jeffrey Mjaanes, sports medicine physician at Midwest Orthopedics at Rush. He's also the director of the Chicago Sports Concussion Clinic at Rush, and Tim Rylander, physical therapist at Accelerated Physical Therapy in Western Springs, and the director of the company's concussion program at Accelerated Physical Therapy. Gentlemen, thank you very much. How can people get a hold of you if they have a child or a kid in fear of possibly having a concussion?
I can be reached directly at Accelerated Rehab in Western Springs at 708-783-1044.
And for me, you can actually go on our website at rushortho.com, or people can call 877-MD-BONES, BONES.
All right. Thank you very much, gentlemen. I appreciate all the information.
Thank you. Thanks for having us.